So we're gonna adjust you first, just so you can get this, and then we're gonna do the manual therapy kind of around after, okay? Nice. 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 Here. Good. Nice and easy. Good. So this is a unique patient. Her original injury was a lat injury. She was laying down on her side like this for about 2 or 3 hours, and all of a sudden she felt a pop or something tear, and all of a sudden that lat had some extra mobility that wasn't there before. Ever since then, she's had some pain there, some pain around the trap, and some pain in the mid-back. So what we did today, or at least what you're seeing, is we started off with some chiropractic care, adjustments through the thoracic spine, lumbar spine, and cervical spine. This patient is a little bit more mobile than most patients, so we really reel in the force, make sure that the joints are getting the appropriate motion and appropriate force. It's something that I think really sets apart a skilled practitioner from others. All right, so relax, little pull. Nice. Good. So breathe in for me, and breathe out. Nice. That was really easy. Good. Breathe in for me, and breathe out. Nice. A little bit more stiffness up there. We're gonna get that to move for sure. There we go. Plenty of range of motion. So, nice. Good. All right, no complaints so far. A little bit of drop here. One more. Perfect. Okay, let's go on your side facing me. Okay, let that relax. Bottom leg straight, top leg bent.
Yep.
Perfect, you got it. Rotate, grab, and then just relax and let it twist. Good, nice and easy. Let's go to the other side. Just twist it here. Good, just let that relax and twist. Ooh, a little bit more stiffness on this side.
A little bit.
Alright, let me move you around a little bit right there. Right there. Okay, just move that twist. Good, that's better. Perfect. Go on your back. Relax, rotate the head. That's good. You've been doing the postural exercises?
Mm-hmm.
Good. You don't let that relax a little bit. Nice. Okay, good. All right, that'll be the adjustments for today. And what I like to add to these adjustments is manual therapy to the regions that have had tension for so long. So we did some trapezius manual therapy, we did SCM, just because as the trap was getting tight, the SCM was too. She had some tension, she had some trigger points. We did subscap as well, and then we also sometimes scrape through the back. Just depends on how she's feeling when she's coming in. Once we've got the tissue mobilized, what I like to do next is introduce thoracic extension a little bit more. So most of the time what that is will be wall angels. Sometimes we'll do thoracic rotation if the patient's already got enough extension, just to add the pair. It's something that combats that consistent posture that we see in the office environment that I'm even displaying right now actually. So as everything rounds forward, we have compound injuries. I like to open everything up again, get the mobility where it needs to be, and then strengthen the correct patterns so that this doesn't become an issue in the future again. And at this point, I see her about once a month, every other month. Really just depends on when she feels like the stiffness is accumulating or the muscle tension is getting to the point where she's not getting full ranges of motion. After mobilizing the spine, adding the soft tissue, adding some exercises, we do have to focus on the day-to-day, so we tossed in some postural spiels that I give pretty much everyone at this point, and corrected some ergonomics of her work environment. It's no big deal, but it really pays off in the long run.